The T-level is a pathway that can be built on throughout the years. The beauty of it is that it opens up pathway to wherever you want to go within NHS healthcare. It gives you the experience and the qualification to go on to that next step into an apprenticeship. A T-level in health or science can lead to a career in nursing, midwifery, biomedical science, diagnostic radiography, occupational therapy or operating department practice. Apprenticeships are a really good route into the profession because it's very structured academic time versus clinical experience time, but you can be flexible with that structure, so it can be really personalised to the learner. Some learners might need a little bit more extra academic time in order to get the results that they require. Some learners might need a little bit more practical experience, and the fact that the apprenticeship puts that flexibility onto the employer means that we can really tailor that experience for each learner.
I come from a military background in engineering, and when I was leaving I decided I wanted to do something that I was genuinely interested in. I always had an interest in the human anatomy and just wanted to understand a bit more and see if I could work with it. When I was looking at doing the degree, financially it just wasn't really viable to go to the standard university route. I have a house and family, so I never would have had that opportunity if I didn't have the apprenticeship. It meant that I could get lots of clinical hours, carry on working with the team I was already working in before and help build those relationships. And doing an apprenticeship means I could carry on working while still being paid, which meant I could sort of stay at home, not have to sell my house and still live a good life.
A typical day in my role as a radiography apprentice, it can be quite varied. Today I'm working in the X-ray department. The day starts with attending to a variety of patients, working between two rooms. You might need to go and support a patient on a ward, so you might do a mobile X-ray. As an apprentice, I have a lecture later on, so I'll go and take that remotely. Today I was able to implement some learning that I learnt yesterday with the same radiographer that taught me, so I was able to sort of recap on my knowledge and have that assessed by him in real time, which was really nice.
Seeing people develop from going from having no experience or qualifications to actually progressing further than they ever thought they could be, and it's really rewarding to be part of their journey.
I think if I hadn't done this job and I'd gone straight into the degree, it would have been a lot more difficult because I wouldn't have been exposed to the different conditions of therapy in the hospitals. And I think that side of it's really important to understand before going into the profession. So doing the apprenticeship allows me to understand that side of it and develop those skills, and also use the skills that I'm learning from the degree and apply them to my own practice. So when I go to see patients, I'm also developing my own practice and being able to engage and understand them better. So essentially I can provide better care for them.
A key attitude to succeed in a healthcare career is definitely that ability to have compassion. Not just a compassion towards the patients that you see, but compassion towards your colleagues too. We are, at the end of the day, in a care profession, and it's really important that we don't lose sight of that. There's so many different careers that you can do within healthcare that are very technical or very science-based, but at the end of the day, we're there to care for people.
From the early stages of working with my fellow colleagues, I learned how they were setting patient goals and how the patients are really at the centre of their care, and that's something that really appealed to me. It's always been one of my sort of drives to really work with people in the community and help empower people, so occupational therapy was perfect for that.
My advice for current T-level students are to get some experience in lots of different professions, because sometimes something can grab you that you least expected.
Be curious, be willing to learn, and always try to engage with the patient, because at the end of the day, they're going to be at the center of your job. So going to the T-level, you're engaging with patients and asking questions. It's a rewarding job because you're making real difference, and as you're learning as well.
Turn your compassion into a career in healthcare.